Sounds good. At the rest of the committee, I'm here to provide evidence-based policing position, obviously on behalf of the ACP and the consequences of prescribed opioids. To be clear, I'm not here to give medical perspectives. I've seen the speaker list, and there's people far more qualified to do that than me. Local data has been compiled for a comprehensive look at the history behind legalized and prescribed drugs, who consume them, organized crime groups who profit from them, and police efforts to impact illegal supply and the overall impact of communities. From what we have gathered, Alberta adopts a similar model as we see in British Columbia. Based on what we know, it will fail. We have looked at how opioid crisis has evolved, especially for gangs and organized crime groups. Producing and trafficking drugs and other controlled substances continue to be a profitable endeavor for street-level traffickers, gangs, organized crime groups, and cartels. Organized crime groups and cartels have historically supplied the demand of illicit drugs, substances such as cocaine, methamphetamine. No need to move the slides. I'm going to get to them in a sec. Just a bit of a preamble. Thank you. Coupled with insatiable demand, fentanyl is much cheaper to supply, as very little fentanyl is required to counterfeit drugs, and the higher potency increases demand, making it obviously far more profitable for cartels. I will expand on shortly with the evolving opioid crisis and even the legalization of cannabis. Gangs, organized crime groups continue to exploit simple supply-demand principles. Lessons learned from the evolution of the opioid crisis should not be overlooked, nor should other examples of regulated supply such as cannabis. In both cases, consumer demand led to opportunities for organized crime groups who were quick to introduce an unregulated illicit supply to run parallel to the legal and regulated supply. In the case of opioid epidemic, what began as a prescribed pain medication has grown into an international health crisis of incredible proportion. Looking forward, we must consider the past to avoid similar outcomes. I'd now like you just to go into the presentation starting on slide 1. The only way we can succeed is if we learn from the lessons of others who have adopted a two-pronged model based on enforcement, obviously, and health perspective. When we look at those lessons learned, they become quite obvious. Organized crime groups and cartels have repeatedly used the same strategy to expand and control commodities in high demand. From prescription opioids, legalization of cannabis, illegal drug markets are filling the supply and demand gaps our legislation and policies create. Let's keep in mind, they do not have to follow any rules. Next slide. Even when you look at legal and illicit cannabis sold by organized crime groups is disguised as legitimate with professional packaging. They have professional websites that resemble legitimate websites. The point, the cartels are innovative and will always have diversified to basically capitalize on the market. Every time the legislation is just one-dimensional, they will come out with a way to make it more profitable. Next slide. If you follow the history of oxycodone, which started in 1996, oxycodone introduced as Oxycontin brand pill, and prescriptions began to increase dramatically. Dependency increased and the users to heroin or powerful synthetic opioids. This presented an opportunity for the illegal drug market. In 2012, Oxycontin was being dispensed at 29 pills per 100 Canadians. February 2012, Oxycontin pulled from the shelves, replaced by Oxyneo, which is fentanyl as counterfeited. Oxycontin introduced and skyrockets. Next slide. So as you can see, obviously, fentanyl over the last several years has taken over heroin. And if you look at the far right, and if you look at when fentanyl actually peaked, things that actually reduced fentanyl was the pill press, which a member of your government was actually essential in bringing that legislation to effect. This led to the cartels yet again pivoting, become more creative, more innovative, and move to a powder, which was the new way to actually produce fentanyl. And when it did that, what happened is it made it easier, but at the same time, the potency got stronger, and then fentanyl has taken over the market, as you can see from heroin. These things will always pivot with every move we make if it doesn't have a fulsome model to deal with it from a health, and I always say law enforcement, we say in ASAP, law enforcement public health requirement. Next slide. This slide is interesting because this is coming out of BC, and BC, through a survey, they look at 405 opioid users. 90% prefer heroin or fentanyl, available primarily through the OCGs, the organized crime groups, and 9.4% prefer a prescription opioid. So if you strongly base the future on the past, the prescription or the history of prescription opioids, it will likely diversify into obtaining illegal drugs and creating an expanded toolbox for our OCGs. It would almost appear, and these are just language that I'm not sure is suitable, but if you were looking at this from a marketing tool, you would almost think that Safe Supply appears to be a marketing tool for opioid prescription based on the history, and that for us is a concern. Next slide. These are some more BC stats that we have got through other law enforcement agencies and through information through BC. The one on the left is very interesting. It appears, even though BC went to the terminology, what they called safe supply, roughly between 18 and 2019, it would appear that the overdose deaths have drastically increased. Now, obviously, we, not knowing there, not BC, and just getting the information, can't say that's the only reason, but it would make us, as law enforcement, ask the question, why is this? And has this contributed? Or is there more things that are needed to deal with this in a comprehensive manner? And for us, what we've been advocating at AACP is for a balanced approach. One that has, you know, the principles of recovery, as others have probably talked about, which really is access to services, with significant enforcement on those that are bringing these large volumes of these harmful drugs, opioids, into our province and our country. The graph on the right shows you that most of these overdoses are due to fentanyl, which is what we're largely talking about today. Next slide. So when we look at what's happened, we look at fentanyl prices as a gram in Alberta, $75 a gram in 2017, peaks at $1,200 in 2008, or sorry, $120 in 2018, and has remained at $150 for 3 years. So fentanyl is obviously has a demand. It continues to demand because it is probably the potency that people are looking for, thus keeps the demand. If you look at meth and what's happened with meth, which is a lot of our violence as well, the price of meth is from an ounce level. It went from $1,200 in 2018 and is now at $500. Again, both of these drugs are largely connected to the organized crime group. Is there no next slide? Okay, I'll just give you some more info. Yeah, there's some more information here. Okay, there we go. These are just some of the recent seizures from our smaller Alberta towns, just that you don't think this is a city thing. Red Deer at Operation Repent, cocaine, weapon seizures, lorazepam, fake oxycodone, ketorolac, senicides, oxycodone. High Level at the here, cocaine, weapon seizure, hydromorphone, tramadol, oxycodone. Red Deer, Operation Raffle, methamphetamine, cocaine, weapon seizures with oxycodone, and assorted pills, yet to be analyzed. Lethbridge, Operation Looper, cocaine and fentanyl seizures, suspected oxycodone, yet to be analyzed. So the point of this is, when you're dealing with organized crime and you're dealing with a lot of the large dealers, whether it's gang or, you know, significantly organized, they have a wide variety of products that they supply. They obviously have a cache of weapons, that obviously this is one of those things where significant violence occurs. So the point being is what you see is potentially could happen. What happened in the oxycodone crisis is a diversification to turn the legal drug to expand their market and what they have to supply to cash in to get the stronger drug. Next slide. So these are just some of the recent seizures. These are mid-level investigations. As you can see, fentanyl, and these are in the last few months. Methamphetamine are certainly the things that are predominantly controlling the drug markets in our province. Next slide. When you go to some other further recent seizures, Project L Essence, look at what we're starting to see. These are significant quantities in our province. 13.6 kilos of fentanyl, 11.9 kilos of fentanyl, late stage, 6.6 kilos synthetic opioids. You guys can read this. This is basically showing you these are the same organized groups associated with violence, heavily associated with profit, that often will exploit our vulnerable people and get people to use their supply. And they have a wide range of products that they can put on the street. So the point trying to show all these is a simple approach to just legislation in relation to prescription is not going to control or change these people from exploiting that. Recent seizures, next slide. Again, 4 kilos of fentanyl, 1.1 kilo of meth. These are large quantities. This is a lot of potential overdoses in our province if these things aren't handled properly or if we can't get them off the street. Next slide. So the emergence of opioid prescribing in other provinces has done nothing based on what we have a cursory overview. Of course, not an in-depth analysis. AACP is doing an in-depth analysis right now on this with an academic. Organized crime groups, we know, will take advantage of the expense at the vulnerable. We cannot let history repeat itself, and we must be able to support for those suffering with addiction, with enforcement, those profiting from vulnerability. Do I have a couple more minutes, or do you want me to stop there?
You can take a couple more minutes, yeah.
Okay. So in conclusion, the emergence of opioid prescribing in other provinces has done nothing to curtail the overdose crisis. This causes us in law enforcement grave concern that we would be jumping into something without knowing what the impact will be. At this stage, we cannot confidently say that if we move forward with similar models that we see in British Columbia, organized crime groups will not take advantage at the expense of the vulnerable. We can't attack this problem by trying to outsmart the cartels. We will not win. Recent history has shown that despite good intentions, legislative and policy change can have unintended consequences. Given the opportunity, organized crime groups and cartels will continue to prosper. Changes in oxycodone regulations led to high demand for high-potency opioids. Organized crime quickly filled the void with fentanyl and increasingly toxic synthetic opioids like carfentanil. Since the legislation of cannabis, organized crime groups continue to service demand through illicit product, often mimicking regular supply, from packaging to online sales to even doorstep delivery options that mimic Skip the Dishes or Uber Eats. Of course, these drugs are way more dangerous than marijuana. There's no reason to believe that prescribed opioid medications won't be counterfeited the same way as we have seen in the past. History has shown us that organized crime groups will always find new ways to make a profit. There will always be a new drug. We need to be smart, cautious in our approach, and get away from being commodity-based. We believe that we need to allow law enforcement must continue to interrupt supply, hold traffickers, organized crimes group accountable. We also believe we will not arrest our way out of this. We can shut down as many drug supply chains as possible, but law enforcement cannot make sustainable changes alone. Changing policy and legislation needs to have meaningful outcomes. The solution we need, we believe, that needs to be created lies in reducing demand. We need to provide affordable, accessible treatment supports for our affected citizens. We cannot move forward with legislation and policy changes without having treatment options in place first. We feel strongly on this, and having looked at some of the things in the Portugal model, this supports and this treatment and as close to on real-time treatment that we can get is a real opportunity for a breakthrough in this space. Let us put the health and safety of our vulnerable citizens first by developing a comprehensive approach on ways that we tackle this on both ends of the supply and demand. The enforcement end for those higher level people that are hurting people, not just one at a time, but obviously it goes to one at a time in the street, but these are your cartels, your organized crime groups, and let's please get some supports in place for the many people we see struggling with addiction and are often seen dying on our streets. We believe we have to do both of these things at the same time. Thank you, and I'll take any questions.
Thank you, Chief, for your heart on this issue and for your presentation. First MLA we have is MLA Stefan.
Thank you for your presentation, Chief Mcfee. I think it's great to have the perspective of law enforcement as you serve in our communities. I happen to represent Red Deer, and I noticed that you had spoken or referred to some of the seizures there. And as a parent, I echo your concerns and requests for more drug treatment. If I had a child suffering under a drug addiction, I would want to love and support them to become free from their addictions. Some of the presentations we've heard have talked about the experience in BC with problems of diversion with the safe supply, and how criminal groups would use the prescribed safe supply medications as currency, including those who are suffering under addictions and seeking to maintain themselves in their addictions, using safe supplies currency to get unclean drugs, if you like, that give them a bigger high, that really getting the biggest high possible for an individual suffering under addictions is often more important than something that may be considered safe. And I put that in quotes. I'm just wondering, from an organized crime group perspective, would safe supply potentially actually encourage more of their supply? Would it actually perhaps help them in dealing with their drugs?
Yeah, thanks, Emily, Stefan. It's a good question. I mean, if you remember that slide I had there in BC where it had the 402 users and roughly 90% of the individuals preferred fentanyl and heroin, and the other 9% preferred prescription drugs. I think that's probably an indication right there. You know, if you are struggling with an addiction, what we've seen in the past, you know, certainly if it's a severe addiction, you have access to getting free safe supply or free drugs. Let's say it's prescribed opioids. And if you want to trade up and get something stronger, that absolutely is a possibility. And I mean, the cartels, as I said, are innovative, and organized crime groups are very innovative. So they can then take that at a very cheap price, and they can actually move that to other areas or other markets that maybe they don't have. So, not to give tangible examples, but let's just talk in potential examples, pill form, to maybe go to somebody younger or somebody that doesn't see this about using a needle and doing. Certainly that could take place in, a university setting or other settings. So this has been a way that the cartels have worked for years. And, to say it won't happen in this one, I guess it depends the extent it will happen. But if you've got people addicted and don't have treatment options, and you've got an endless supply, and that's your only focus, you absolutely will find the way to get the currency, whether it's through that or through, petty crime or thefts or whatever, to get the money to turn that into what you need to support your severe addictions. So again, that's just why we reiterate that we need both the systems in place, the enforcement partnered with the treatment. And nobody that I've heard, certainly in policing, probably in the country, but certainly in Alberta, wants to put people in jail just for a drug problem. But unfortunately, it gets tied into many other things in the criminal activity too. But the point being is right now there's nowhere else to put them. So I think, as you've heard, those are things that are kind of must-haves, if I could say, is that treatment options.
Sure. And can I just ask a quick supplemental?
Yes, sir.
Does the police in British Columbia, have they stated a position that you're aware of in respect of safe supply?
Yeah, their position, they came out with a position paper here not that long ago, and they're saying it a bit different. I think they want the supports in place. Obviously, they have a safe supply environment, so it's a bit of a different angle. Our angle at AACP is we do not want safe supply at all till we get some supports in places. And same, along the lines of decriminalization, we need these supports and treatment options that people can get into to help themselves and help others. And that obviously will reduce the workload and the number of people that are coming into policing or into the justice system. So the chicken and the egg, I would lend to get the supports in place first before we take changes of legislation like we've seen in Oxycontin that could make it worse.
MLA Milliken.
Thank you, Chief, for being here. Very much appreciated. It's a good different point of view than some of the other individuals we've asked to come and give us their perspectives. I'm assuming that you probably have some connections to police in BC. I'm just wondering if you could briefly expand on perhaps the experiences that you may have heard coming out of, say, East Vancouver with regards to how it has affected police resource needs in the area.
Yeah, anecdotally, police are still responding to overdoses, as you see. And they've got other agencies responding with them, but there's certain ones that they have to do. I think the biggest thing is it's, as you've seen in the graph that I showed, the crisis continues to grow. And obviously compounded by COVID, obviously is going to have an impact on that with people struggling. So, I think it tends to come on us. And do we want to be dealing with overdoses? No. What we want to do is deal with the people that are creating and giving people the money or the product to overdose. And then what we also are seriously advocating is the appropriate on-demand supports to get these people healthy, as many as can. And I think that's the whole point. I'll give you an example. We have Sublocade and Suboxone recently introduced by the government in our DMU. Our DMU is our detention center, and that's been in there for 2 months. And Sublocade and Suboxone obviously is a way between 24 hours and up to a month between the different options to get people to stop them from overdosing, so they can actually get the appropriate intervention to hopefully get some help they need to deal with their severe addiction. Over the course of those 2 months, we've had over 200 people take that up. So that's a positive sign. That's what we're talking about, is dealing with this differently. Take advantage of the opportunity by having those treatment options when you do attend these things. And if somebody does get to a position where they're surviving or potentially in recovery, can you try to get them off this tangled web or this hamster wheel they're on? So, if your only option is to give more drugs, I don't think it's going to end well. It's just going to continue to see supply grow and, as you know, increase the profits of the cartels.
And just to follow from that, policing then moving towards sort of the judiciary or court side of things, you used words in your presentation like decriminalization. You mentioned Portugal. You talked about how we can't arrest our way out of this. What tools would you potentially like to see in perhaps conjunction with the regular criminal court system that you might want to see as an option instead of just handcuffs and detention? I'm not going to answer for you, but you mentioned Portugal, and they have sort of an offshoot with the Commission for the Dissuasion of Drug Addiction, just as a.
Yeah, that's a great question, actually. And one of the things that we've actually kicked around at, because let's face it, as police services, we don't want to just keep putting people who are struggling as addicts with all kinds of things going on in their life, putting them in jail, because we know what happens when you mix low risk and high risk in jail. They all become high risk. But if there was some type of mechanism or partnership between police and health, and if there was some type of administrative sanction or something that, that had some binding agreement where people had the choice to actually choose another option versus let's say a correctional facility or the courthouse, I think that would really, really potentially work. I think it was Portland that they tried it. I don't think it went far enough. It was one of the U.S. states, but I think with the right minds in the room, focusing on treatment options with, some binding power, giving that individual that's facing the crisis some options to choose. Every 2 out of 10 you get to choose properly and maybe get them on the road to recovery or treatment, or 5 and 10. I think you've created another tool in the toolbox that would be very effective and hopefully would prevent a lot of overdose deaths and get some people's lives back. And, when I did the podcast with Tom from the book San Francisco, Tom Wolf, that was the thing. It was an intervention point generally, and we've heard it over and over and over, a timely intervention point where some type of accountability got it into some system with the right individuals, found them at the right time when he said he kind of had enough, and that's what led to recovery. And that story is repeated over and over and over, but we've never unpacked that and put a process in place to make that story possible in each and every case.
Emily Amory.
Good morning, Chief Mcfee, and thank you for coming before this committee and raising some of the emerging concerns that you've highlighted in your presentation with respect to the law enforcement side of things. And I wanted to talk a little bit about your slide deck, because I found it particularly interesting that you raised the issue of organized crime groups and cartels. We've not heard that perspective thus far, and I just wanted to ask you, I know that you've only had 10 minutes to provide your initial comments and presentations with respect to some of the concerns that you're seeing, but in particular, I wanted to ask if you could talk a little bit more about the supply and demand component that you reference in your slide deck, and particularly on page 2 of the slide deck. You talk a little bit about supply and demand and how organized crime and cartels are utilizing the potential high demand market to expand their role here in Alberta. And I wanted to see if you can expand a little bit on what you've seen so far, what evidence you have that you can share with this committee to suggest that organized crime organizations and or cartels are expanding their efforts in Alberta, and what you might be able to predict for the future if a safe supply or a safer supply model comes here to this province.
Yeah. I mean, we base all our stuff on, intelligence. We have a provincial intelligence agency, obviously, that links into the National Intelligence Agency. So we get intelligence from everywhere. And a lot of the product that we're dealing with in relation to the cartels, I mean, obviously, they need to move that, and Canada is a country where a lot of stuff gets moved, but sometimes we actually turn into exporters of certain drugs as well. Some of the big takedowns that we've taken down over the last couple of years, and the influence of individuals known to us being involved in those are the ties that you put together. So you're looking at it through intelligence piece. They're going to be here regardless if we have safe supply or not. The difference is what's happened based on the history is, and that base they're going to be here, but that's something we're always focused on. But the difference is if you follow the oxycodone, if you follow what they did in marijuana, we think that if somebody's saying they think this is going to stop that, it's not. They're just going to diversify and find other ways to put their product and collect maybe the safe supply and get the more potent product on the street. And they're developing drugs all the time. Like, I mean, fentanyl several years ago wasn't a big thing. Now it is. Oxycodone kind of came in, went out. Meth was up and down through the years. There will always be a new drug. And those are the individuals that spend a lot of time working on what that new drug is, and then they got to push it out to the markets. And it was kind of a bit of a myth, actually. I heard one comment that was a little bit humorous over this difficult time that we've been going through COVID. Is somebody said, well, overdoses have went up because the borders are closed. Well, the borders have always been closed to illegal drugs. I mean, so they just find ways to bring the drugs in, no different than anything else. So I think it's always a concern for us. Not going to get into a lot of the details because this is a public forum, but I think in relation to that, we get quite good intelligence in this area.
Yes, thank you, Chief Mcfee, for that answer. As you, I think, correctly identified in the presentation at the beginning, you mentioned that we have heard from numerous experts on the subject of safe supply. And I think if I can summarize some of the information that we've received, it's that these experts have quite consistently, I think, raised concerns about what they've described as addiction maintenance when describing safe supply. Instead advocating, I think, almost unanimously for the strengthened model of addiction recovery. We've heard that individuals almost universally continue to use illicit drugs in addition to safe supply prescribing, which I think inevitably increases the overall use of substances as a whole. When we talk about the supply and demand in the market that is being created potentially for cartels and organized crime, is this a cause for concern for you? Do you foresee a safe supply model which increases the amount of prescription opioids being distributed to individuals as an invitation to cartels and organized crime here in Alberta to operate?
Yeah, well, again, it just diversifies their portfolio. So there's always that ability, and if you go and you make your predictor, if the past is your predictor of the future, then yes, that's a good likelihood that's going to happen. And on the other stuff that you mentioned is, what we're saying is we need many tools to fight this. Sublocade, Suboxone, and Acetaminophen one. Yes, there's going to be some safe consumption in relation to that because that's a state and time. But we need treatment. We need the ability to get people into a bed, the ability to get people into a recovery-orientated system where it has intervention, treatment, prevention, and some of that's going to be enforcement. The problem is how I see this. Anything that you're putting in one-dimensional has never worked to date, and I'm not sure anything you put in one-dimensional will ever work. Because if it was that easy, people would have solved this a long time. And just to come out and say this is going to fix our problem, I think is probably the biggest understatement that I've ever heard. And in fact, when I look at that graph in BC, where it's gone straight up since, it makes me ask a lot more questions. So I think it's medical experts, law enforcement experts, and some lived experience experts collectively together to figure out, among others, to figure out how we actually build a system and not a program or a stream, a one-dimensional stream.
Thank you, Member. MLA Stefan.
Thank you. And I've really been interested in your answers, and so I appreciate being able to ask another question again from a law enforcement perspective. One of the concerns that we have heard from some of the presenters in respect of safe supply is that it institutionalizes and normalizes the use of these harmful drugs. And I'm wondering that from your perspective in law enforcement, that if we normalize and have increased use of drugs, does it naturally follow that there will be a rising tide in collateral crime in communities as individuals seek to, whether through organized crime directly or indirectly, maintain themselves in their addictions?
Yeah, I mean, organized crime, I would put it a little bit differently. That certainly they're at the start of a lot of this, bringing it into the community. And then when it gets to the street level, they have other people that move the product for them. So they're really hands off. I think what you see though is obviously if you have a severe addiction, you need to find the money or the capital to service that. So, now it could be through your medication that's not strong enough for you. You want a stronger thing, so you want to trade it in for fentanyl or something harsher. If you're mixing fentanyl and you're living on a street because you've lost your ability to do that, and all of a sudden you take meth. Meth makes people violent, so you got to look at the culmination of the drugs. But I think the whole thing here too that's really struggled with in Alberta right now, and certainly in Edmonton, is it seems like open drug area use is okay, and that also brings perception and harm to a community. And and part of that is because we maybe don't have the adequate treatment facilities. We're focusing on, again, a one-dimensional thing, and we're just allowing this. So those are some of the concerns I would have. I think that some of the things that are being looked at based on what the previous speaker said in relation to how you build a system, I think, we need to become the first in Canada to build a whole system here. And I think if we get that right, I think those efforts will start to help in all aspects of this. I've been in this business a long time, been in government as a deputy minister for a long time, and I'm always a bit miffed how individuals or groups think they can just pass a piece of legislation and everything's better. I haven't seen it work yet, so I would like to see focus on a system approach, which, as that previous speaker mentioned, a recovery-oriented system. How I see that as a conglomerate or a continuum of services that meet the needs of every individual. And I think if we can do that in Alberta, I think we're going to solve the Cadbury secret that's been missing for many, many years.
Thank you, Chief. That does conclude our time for question and answer today. We sincerely appreciate you taking time with us and for your presentation. And thank you.